The last part of this module is to understand what happens when your loved one uses, both the short-term and long-term consequences, the positive ones and the negative ones. For some of you, this is going to be obvious, but for others, writing this out in black and white will be the first time you see it all so clearly. It's important that you get an accurate assessment of the positive and negative consequences of your loved one's use. Not only will it help you to assess the problem, but it will give you ideas of what may influence your loved one to lower their use or to seek help. Doing these exercises may bring up difficult feelings, so it's important not to ignore them. Rather, go to Module 7 for help with these feelings, or write about how you feel in the sanctuary. It's important to realize that drinking or taking drugs only resolves problems momentarily for your loved one. It's a way to cope with life in the short term, often by some form of avoidance. This next exercise asks you to list what your loved one would say are the positive things that happen when they use. The next question may surprise you, but what's the upside for you when your loved one uses? Without meaning to, you may be getting some benefits when they use. Perhaps it's feeling needed or not having to focus on your own problems. This isn't about blaming yourself. You're not the cause of their using, but don't be blindsided either. If there are things that weaken your motivation to take action or that weaken your message when your loved one is using, writing it down will make it clearer. It's important to see what is true for you. And of course, there are bad consequences to your loved one's use, both short-term and long-term. In this exercise, list the ones that happen pretty quickly while they are using or just afterwards. And finally, what bad things do or will happen long-term if your loved one continues to be high or to drink.